the hilly terrain of Moiben Division in Uasin Gishu district. Here, healthcare services are like a hidden treasure. They are few and far between. MEIBEKI healthcare facility is the only hope for residents here. Motorbikes are the only means of transport for patients seeking healthcare. Kenya clearly still falls short of international standards on healthcare accessibility.
WHO requirement says that everybody living in this century should be near a health facilities within what distance? Is it 5 kilometers or 3? 5.
Healthcare officials in this division say transport is not the only challenge choking the healthcare system here. This hospital is manned by only 2 nurses. Now they can't handle serious cases here, so they have to refer the cases to either the Moi Teaching and Referral Hospital or the Iten District Hospital. Both are more than 30 kilometers away.
Sasa ukirifaa mgonjwa hata kama ni serious na mnakani anaomba Mungu yake tu for the next day ifike asubuhi aende.
Regina TARUS is the nurse in charge here. When we arrived, she was alone at the facility. Her colleague had left to administer polio vaccines at homesteads far away. Residents told me that there was a time when the facility had grounded to a halt, leading to a major demonstration. That was when Regina had gone on leave and her colleague coincidentally fell sick. Currently, there are only 36,000 nurses serving the 37 million Kenyans, a number way below the WHO requirements for a country like Kenya.
To tell you the truth, we have a very terrible shortage of doctors and a terrible shortage of nurses. The irony, however, is that we have a lot of nurses in this country who are not employed. They are waiting for government to employ them.
The situation is equally appalling in MBARUK location in NAIVASHA district.
Kitu naitwa chemist hiyo sahau hakuna. Hata ile kliniki kidogo hakuna hata.
MWANGI says a cholera outbreak last year dealt them a major blow.
Wengi walipoteza maisha yao kwa sababu kabla sasa wale madaktari upande wa Nakuru kufika, watu wengi walikuwa wamekufa kwa sababu hakuna dispensary karibu ambao watu wangekiasa ukimbishwa na kufika huko.
The sick here, he says, are hanging by a thread. Not far from the road was one such case. This gentleman tell me there's a man sick in this neighborhood, a man who was attacked by a buffalo about 3 weeks ago. So I'm going to see how he's doing. DOMINIC MAINA is a man in pain. He was discharged after a week at the St. Mary's Mission Hospital on his own request because the bill was fast getting out of his means. He is, however, required to make frequent visits to the hospital for checkups. At 3 in the afternoon, he had lost hope of getting to the hospital, which he says is the nearest.
Kama kilomita 20 na kufika huko siwezi enda na mguu wala hakuna gari. Sasa transport yenyewe ni ngumu kupata.
We offered to take him for the checkup he so much needed. The buffalo tore at his thigh muscles, rendering his legs too weak to support his body. The Ministry of Medical Services, however, says it is working within its already strained budget to better the healthcare system.
There are 37 hospitals all over the country that are in the pipeline to being rehabilitated and the whole infrastructure improved.
Perhaps the situation would be completely different if the government abided by the Abuja Declaration, which requires countries to allocate 15% of their total budgets to health ministries. Currently, Kenya spends only 6% of its budget on health.